I'm sorry we haven't been blogging for a long time, but we're making it up to you today. We have a really, really special guest today, and I'm actually going to let him introduce himself.
Thanks, Celia. I appreciate it. Dr. David McBride from Student Health Services. We're located at 881 Commonwealth Avenue, which is right next to the Fitness and Recreation Center, which everybody knows. We're available to all full-time students, all students with the student health insurance, and then students who are greater than 75% time. So you don't have to have the student insurance to see us. We'll see anyone regardless of your insurance choice.
That's very cool.
Yeah.
All right, so tell us a little bit about, we've got a lot of new students coming in this week for FISOP, orientation, that kind of thing, but we've also got returning students. Tell us a little bit about how Student Health is a resource for all students.
Sure, absolutely. Well, we provide both immediate kind of urgent care as well as ongoing and primary care for students. So we do things like physicals and pap smears, but we also see people for injuries and coughs and colds, and immunizations obviously are required of everyone in order to be a student. We have a cadre of physicians, nurse practitioners, nurses, medical assistants, and then we have a full-service behavioral medicine department that does primarily short-term counseling, evaluation, referral. They help students who've had traumatic events in their lives, like loss or accidents that have affected their ability to function appropriately. So those are kind of a quick list of the things that we do.
Great. It sounds like Student Health is a great resource, but I personally am pretty freaked out about H1N1 swine flu. I'm sure everybody else is too. We've all read the headlines about the upcoming year, and we're concerned. So tell us what Student Health is doing to deal with that.
Absolutely. Well, I'm a little anxious about it as well, and I think a lot is because we're not sure exactly what's going to happen. Celia, I think we're pretty certain that there is going to be a significant number of people who are sick with flu-like illness, particularly in the fall. So a couple of things I wanted to share with folks about prevention. One is get a flu shot. The regular flu shot doesn't protect you against swine flu, but it does protect you against seasonal flu, which also can make people quite sick. We'll be offering flu clinics beginning in September for students. The second thing is, if you're sick, you need to stay home in bed. Sometimes that's a tough decision for college students to make because they're concerned about missing class, but really it's best in terms of your own health and protecting your fellow students if you stay home in bed, drink lots of fluids, take Tylenol or Advil for fever, and then when you're feeling better, back to class again. The third thing is, I think it's really important that students remember to wash their hands. It seems like a really simple thing.
So little, yeah.
Right, exactly. But it's one of the things that we know helps people to stay healthy. So wash your hands before you eat, after you eat, obviously after you come out of the restroom, and those kinds of things. And then, the last thing we encourage people to do is, if you are sick again, make sure that you cough into your sleeve.
To your elbow, okay.
Right, and not into your hands, because if you cough into your hands and you don't clean your hands, and you're touching things and you're spreading germs around. So I think those are all really important prevention messages.
Yeah, absolutely. So that sounds pretty good. I think we have a good idea of how to prevent H1N1 from spreading around campus, and we're going to take care of ourselves in that light. And also, it's just really good to hear about student health. I think getting it out there and talking about it is really great. So thank you so much, Mr. McBride, Dr. McBride.
Absolutely,
it's
Celia.
So great
it's really
to
nice
chat
to
with
see you again.
And we'll see you guys later
Take
on the
care.
blog.